Reliability and accuracy of a novel classification system using peroral cholangioscopy for the diagnosis of bile duct lesions. Introduction. Endoscopic retrograde cholangiopancreatography, ERCP, has an important imaging limitation in the diagnosis of bile duct lesions, leading to the risk of missed pathology and sampling errors. Recently, the development of a new single-use scope for cholangioscopy, called Spyglass, Boston Scientific, Marlborough, Massachusetts, United States, has enabled the direct visualization of the pancreaticobiliary system for the evaluation of intraductal lesions. It has been demonstrated that the use of Spyglass and the SpyBite forceps changes clinical management decisions in 64% of patients. The system has a sensitivity of 76.5% for indeterminate stricture diagnosis, compared with 29.4% and 5.9% sensitivity using blind biopsy or a brushing catheter, respectively. Regardless of the instrumentation chosen, the macroscopic features used to determine malignancy of bile duct lesions during peroral cholangioscopy, POCS, are the presence of an irregular surface with bleeding and oozing or tortuous vessels. In contrast, benign lesions typically have a smooth surface without vessels or mass. However, despite these well-defined features distinguishing neoplastic from non-neoplastic lesions, many misdiagnoses are made, owing to the lack of a correlation between these macroscopic aspects and histology. Moreover, masses are sometimes benign. The aim of this study was thus to propose a new, more detailed macroscopic classification of bile duct lesions based on the morphological and vascular patterns observed during POCS. Background. The aim of this study was to propose a novel, comprehensive macroscopic classification for bile duct lesions. Methods. A two-stage protocol was designed. In Stage 1, a retrospective study, September 2013 to September 2015, of patients with bile duct lesions detected by peroral cholangioscopy, POCS, was performed. A total of 315 images with at least 6 months of follow-up were recorded, analyzed, and correlated to histology, and were classified as non-neoplastic, one of 3 types, or neoplastic, one of 4 types, based on morphological and vascular patterns. In Stage 2, a prospective, non-randomized, double-blind study was performed from December 2015 to December 2016 to validate the proposed classification. Sensitivity, specificity, positive and negative predictive values, and positive and negative likelihood ratios were calculated. Gold standard 6-month follow-up. Inter- and intra-observer agreement, kappa value, among experts and non-experts were calculated. Results. 171 patients were included, 65 retrospective, 106 prospective. In Stage 1, 28 of 65 cases were neoplastic, and 37 of 65 were non-neoplastic, according to the final diagnosis. In Stage 2, 56 of 106 were neoplastic with a sensitivity, specificity, PPV, NPV, LR positive and LR negative for neoplastic diagnosis of 96.3%, 92.3%, 92.9%, 96%, 12.52, and 0.04, respectively. The proposed classification presented high reproducibility among observers for both neoplastic and subtypes categories. However, it was better for experts, kappa greater than 80%, than non-experts, kappa 64.7% to 81.9%. Conclusion. The novel classification system could help physicians to distinguish non-neoplastic from neoplastic bile duct lesions.